Thank you for attending the annual American Society of Acupuncturists conference. I hope that you've gotten a lot out of the presentations this weekend. I've certainly appreciated everyone coming together, you for showing up, all of the presenters and all of the time spent, everyone who's here to try and improve our profession. Thank you. Our committee includes myself, Tuesday Wasserman, as the chair of the committee. Today, we're bringing in guest Chanda Hinton to talk about the spinal cord injury waiver in Colorado, why Medicaid coverage matters, why it matters for the individuals receiving acupuncture, and why it matters for us as providers. And our board liaison to the Medicaid committee is Amy Major. Other committee members include Jared West, Laura Ocker, Joe Pandolfo, Denise Tyson, and Beth Howlett. As you heard on Friday, when it comes to Medicaid coverage, there are several different roads we can take to get to Medicaid coverage in our states. And from there, they further diverge. Sometimes we go through legislation. Other times we go through the state. Sometimes going through the state is just going through one state implemented plan. Other times it's working with the different plans who the state has contracted coverage out to. And when it comes to gaining coverage, that's one step, but expanding, maintaining, and increasing the scope of that coverage is an ongoing process. You heard from a handful of our states. Today, you're going to hear from Colorado in the spinal cord injury waiver. You got to hear from Denise Tyson in Maryland, and know that in Maryland, Medicaid covers acupuncture services for pediatrics. They are in the process of expanding that coverage so that adults can be included. You heard from Amy Major about Massachusetts and their two holdout plans because of the way Medicaid is run in Massachusetts. It's a little different. And so they're working with individual plans, and hopefully we'll have good news soon about that expanded coverage in Massachusetts for Medicaid participants. We have cases like New Jersey, where Medicaid does cover acupuncture in lieu of anesthesia. As acupuncturists, we know there are a few more conditions we would like to work with. Pain management is excellent, but as we see on the right, addiction-related treatment, back pain, neck pain, depression, anxiety, a wide variety of conditions can benefit from acupuncture therapy. And we should all be so lucky as the way things are implemented in Oregon State, where they focus on quality evidence. And if you can present peer-reviewed evidence, Oregon State will look into covering those conditions. They cover them for their Medicaid participants. And for us, as the people engaging in the system, that's always keeping some contact with the state. That's working and going back and forth as new research comes out, letting them know what's happening so that we can get coverage for those Medicaid participants so they can get the services they need. We also heard the theme about gaining coverage, about what it means in advocacy, and several of our presenters discussed it's important to show up, bring quality evidence, and be a team player. Amy Major mentioned the Tick and Nielsen paper several times, so I thought I would share with you and add it to your resources, the evidence-based non-pharmacological strategies for comprehensive pain care that was put together by the consortium. This is fantastic research. It's worth taking the time to read. And by the end of this conference, I hope that you will understand or reach out if you need help taking research, reading it, and then submitting your time to get continuing education credit. This is one paper that I hope you'll start with. Another fantastic paper was by our guest, Robert Davis, who presented on the Vermont pilot program administering acupuncture services in the Medicaid population. They wanted to know if it was feasible to introduce acupuncture to Medicaid populations. It's not going to come as a surprise to anyone in this room that acupuncture treatment for chronic pain was both feasible and well received. As acupuncturists, we expect this. This has been our experience day in and day out. However, when we're working with legislators, when we're working with policymakers, it's really important to remove some of that bias from our clinical experience by presenting peer-reviewed research. Amy Major has generously offered to share advocacy tools that they've used in Massachusetts, and the following are excerpts from research that we've used in Colorado when working with policymakers and legislators. As you heard over and over again, is it cost effective? When we're looking at state-run plans, we're looking at government plans, the cost is going to be an issue. And we do know that acupuncture is cost effective, especially when used as a complement to standalone care. And this comes back to being a team player. Acupuncture is part of the solution, but it is not the only part of the solution. When we look at cost savings research, if we look at the research that comes from interdisciplinary clinics, we find the most significant cost savings and the most significant outcomes. This was from the pilot research out of Rhode Island, where they found that every dollar spent on complementary services, including acupuncture, yielded a savings of $2.41. Furthermore, the patients got better. Of course, it reduced their medical costs, it reduced their ER visits, but it also reduced their opioid prescriptions by 86%, which is significant for the quality of lives, the reduction of pain, and the reduced risk of addiction for those pain patients needing additional support. When we look at interdisciplinary research in pediatric populations, we see the same cost savings. This interdisciplinary team included physician services, medication, acupuncture, massage, and biofeedback. And what they found is when working together as a team, the patients had the most significant outcomes. They had fewer visits to the emergency department, shorter hospital stays, reduced medication, and all of that led to a cost savings of more than $36,000 per patient for the hospital and a direct cost savings of more than $11,000 per patient per year to the insurance companies. And not only do we know that acupuncture is effective and it's cost effective, but acupuncture also leads to lasting results. The research by McPherson and his team demonstrated that acupuncture for the management of pain, such as neck pain, shoulder pain, osteoarthritis of the knee, headaches, and migraine headaches, 90% of the benefits of treatment are sustained for at least 1 year. And so when patients and insurance companies are investing in a course of treatment, they can be pretty sure that their investment is going to lead to lasting results and significant improvement. And so I'd like to share with you this video from Chanda Hinton from the Chanda Plan, talking about the spinal cord injury waiver in Colorado, and a little bit about why it matters to the patients and why Medicaid coverage matters to us as practitioners.
Spinal cord injury waiver is actually, I would say, is kind of the backbone to the organization. So that was the first initiative I personally took as the founder and executive director of the organization upon dealing with my own spinal cord injury and identifying that acupuncture, massage, and chiropractic were three components at the time of my spinal cord injury, being 21, having severe chronic pain, and realizing that I needed to tap into more proactive and preventative things. And so upon me doing that and going through my own journey, I then reached out to Medicaid back in 2007 and said, hey, I'm doing things for my spinal cord injury that are proactive, preventative, save money, laying out. And if you look into my claims, you'll see that you've spent all this money with reactive care, whereas you can see there's a lot of savings, no dollars spent on that reactive care, because out of pocket, I've been paying for proactive care, which is the acupuncture, massage, and chiropractic. And they had mentioned that, that's a legislative decision. That's something that you need to propose to the legislation around having Colorado Medicaid look at those modalities and fund those underneath Medicaid. And so at first I thought it would be a simple call to a supervisor, which I was very naive, which is completely okay. Because I think when you are naive, you have the ability to ask, questions that sometimes you don't think are okay to ask. And by me asking a naive question, I was directed into the right place, which was talking with legislation. And that's where the spinal cord injury waiver truly began, as we went to, we had a bill in 2009 presenting that we wanted Medicaid of Colorado to fund acupuncture, massage, and chiropractic for people with spinal cord injuries in the Denver metro area, to prove to Medicaid that we could be cost effective with a larger group of folks that are, quite frankly, very costly in terms of the secondary conditions that come with living with a spinal cord injury. We have independent contractors that are acupuncturists, and we're giving them, it's absolutely a job opportunity. I think it's so critical that people really try to look at the Medicaid program and educate themselves on it, and realize that, it isn't as bad as a lot of people will indicate. And there are very important and easy ways to administrate some of that, because it makes me so sad to think that, there's this opportunity for acupuncturists to be a part of Medicaid, to then give a population that is in need of something there. But yet, if the system doesn't support the ease of them becoming a provider, then it's counterintuitive. And so I can see that it's an interesting process, but I hope that providers are more encouraged by the impact that they can create on lives. That I really believe that we should all be looking at, when we think of the services we provide in acupuncture. Again, realizing that acupuncture shouldn't be a service to the wealthy, right? Knowing that while you may be getting only a certain amount underneath Medicaid, where are the discussions around, health being a right, and health being, less money for this individual, but the value around that, the value of their impact, the thinking about the difference of economic, like, brackets. And it's like there's a lot that you think about when it comes to the philosophy of, like, acupuncture. And when you're in the world to serve, where do you balance that, right? And I think that is something that is really critical. And I know that, there are times where we have providers that will want to serve our participants, and they love the fact that they can just get away from the administrative side of it and just serve and be paid, and not at a crazy price, but at what feels like a reasonable price, right? And so I think that those are all really big questions for all people to be asking themselves. But I think that it's been something that's come up for us recently, where it's just kind of like, we fight to make these services available. And if we fight, we want to make sure that we're in alignment with the providers that we're fighting for as well, because we're impacting humans, and that's really critical. And I think that when people go into medicine, I mean, I know a lot of doctors that they went to become a doctor because they wanted to change lives and care for humans. But when we get caught up in the system, sometimes we forget that. And that's what I think that's what I want to leave as a last thought, is to not forget why you went in to acupuncture in the very beginning.
I hope you enjoyed the conference and our presentations. Please feel free to reach out anytime with any questions. And thank you so much for being part of the solution. Take care. Our references will be made available to you, and this PowerPoint slide deck is going to be available.